So now let's get to the case studies. In this first case, the proband was a 56-year-old woman diagnosed with dilated cardiomyopathy. The father died of a heart attack at age 66, the grandmother in her sleep at age 60, but no cases of dilated cardiomyopathy. And the patient had no risk factors for dilated cardiomyopathy. And so it was stated that she likely got this disease as a result of a virus, as a complication from a virus. But a few years later, her daughter, at age of 36, suddenly died. And then the autopsy showed that the daughter had dilated cardiomyopathy as well. And then it was assumed that, oh, this is probably genetic after all. And at the time, there were about 10 genes known to cause dilated cardiomyopathy and sudden death associated. And all of those were dominant mutations. And so the proband was tested for those 10 mutations, but she didn't have genes, did not have a mutation in any of those genes. But it was assumed that she probably had another mutation in a dominant gene, and that she gave the bad gene to the daughter, and the father gave a good gene, but one copy of the bad gene was sufficient, and so the daughter got disease. And it's unknown which of the parents, one can hypothesize, but it's unknown which of the parents gave this daughter the bad gene, but we're hypothesizing here that it was the father. Then there would be a 50% chance that the other sibling would also inherit the bad gene from the father. And there's a 50% chance that the brother of the daughter who died would also have inherited the bad gene. And so the cardiologist recommended that all first and second degree relatives, all of these four, undergo yearly echocardiograms. And this patient went to his doctor and related that information. And the doctor said to him, is your mother sick? Does your mother have dilated cardiomyopathy? And he said, no, my mother's perfectly well. And so he was advised by his physician that you don't need genetic testing because your mom is perfectly healthy. And so I want to ask you guys if you can answer in chat or maybe raise your hand. I don't know if I can see very many of you. Was this physician correct? Is this true that the genetic testing was unnecessary because the mother did not have dilated cardiomyopathy? Okay, I'm going to wait. Can I see something in chat? Or somebody unsilence and answer, please.
Hi, this is Mordechai. I think it just depends on what your kind of sensitivity threshold is to find disease. You know, some things we do only have 25% efficacy to, which you could argue maybe this has too. So I think it just depends on if you think 25% is relevant. But I don't know if it's right or wrong.
But you're not saying it's because the mother didn't have disease. You're saying it's only a 25% chance. Maybe we don't want to test for that. The 25% chance that you're going to drop dead. But the point is, thank you. It is correct that we do not know, just because the mother does not have dilated cardiomyopathy, we don't know that she doesn't have the mutation that causes dilated cardiomyopathy because of penetrance and because it may not have, the disease may not have appeared yet. But she could still has a 50% chance of giving that mutation to the son. So thank you. So what I want to stress in this talk is that family history can be tricky, that even if someone has the disease-causing mutation, they may not show the disease now, or they may never show the disease. And even if they, and the penetrance is a term I'd like you to walk away with, tells you the chance that someone who has the mutation will actually get sick. And in the 73